My name is Dengue. Yes, I admit to spreading the dengue virus that has killed hundreds of people across the world. And I confess that I will not stop. You may have caught me, but my sisters are out there doing the good work.
Hi, we are the group 2, and today we are going to discuss about the disease dengue. Here's all what you need to know about dengue. So dengue, as we all know, is a mosquito-borne disease which has spread rapidly all throughout the world in the recent years. Dengue is widespread throughout the tropics, which is also very rampant in places which are humid, has heavy rainfall, and is influenced by temperature. So dengue also causes a widespread of disease which can lead to subclinical diseases or a severe dengue. So severe dengue is much more dangerous because it can lead to complications and worse, death if not treated appropriately.
And I'm going to discuss about the epidemiology of dengue. So dengue is a disease caused by one of the 4 closely related dengue viruses. So dengue is present in the Africa, the Asia, Caribbeans, the Americas, and in the Pacific. In Asia, dengue, which is the world's most important mosquito-borne viral disease, is endemic in the Philippines. During 2008 to 2012, the country's Department of Health reported an annual average of 117,065 dengue cases that placed the country fourth in dengue burden in Southeast Asia. In 2021, as of February 20, 2021, the Philippines reported 10,260 dengue cases, including 32 deaths. The number of cases is 72% lower compared to the 37,487 cases that were reported in the same period in 2020. Risk of dengue is present throughout the Philippines, with the most cases in Negros Occidental Province, followed by Iloilo Province, Aklan Province, Antique Province, Capiz Province, Iloilo City, Bacolod City, and Guimaras.
My name is Ellen Claire and Bayana, and today we are going to talk about how the dengue virus transmits. How does the dengue virus spread? So the dengue virus is transmitted to humans via the bite of an infected mosquito. Only a few mosquito species are vectors for dengue virus. So before anything else, what is a vector? A vector is a vehicle that carries and transmits diseases to its host organism. Vectors include animals and microorganisms that transmits or carriers of the different diseases. Dengue cannot be spread directly from one person to another, and mosquitoes are required or are necessary for transmission of the dengue virus. Can any type of mosquito carry dengue? The primary vector of the dengue virus is the Aedes aegypti. It is the principal dengue vector responsible for the transmission of dengue and responsible for dengue epidemics. The dengue virus is spread to human to mosquito to human cycle of transmission, typically 4 days after being bit by an infected Aedes aegypti mosquito. A person will develop viremia, condition which there is a high level of dengue virus in the blood. Viremia lasts for approximately 5 days but can last long as 12 days. On the first day of viremia, the person generally shows no signs and symptoms of dengue. 5 days after being bit, the person develops symptoms of the dengue fever, which can last up to a week or longer. Are the mosquito bites the only way the dengue virus can be transmitted to humans? So in rare events, The dengue can be transmitted during an organ transplant or blood transfusion from infected donors. There is also evidence that the infected mother can transmit the dengue virus to her fetus. Despite these are rare events, and this majority of dengue infections are transmitted by mosquito bites.
Greater risk of developing dengue fever or a more severe form of the disease if you live or travel on tropical or subtropical areas. Being in tropical and subtropical areas increases your risk of exposure to the virus that causes dengue fever. Is if you have had dengue fever in the past. Previous infection with the dengue fever virus increases your risk of severe symptoms if you get dengue fever again. You have stagnant water in your area. The presence of water-holding containers in and around the home needed for the mosquitoes to complete their development sustains the reservoir for disease and is a risk factor. This in particular genes have been linked with an increased risk of severe dengue complications. Next, severe disease is more common in babies and young children, and in contrast to many other infections, it is more common in children that are relatively well nourished. Factors for severe disease include female sex, high body mass index, and viral load. While each serotype can cause the full spectrum of disease, virus strain is a risk factor.
For the signs and symptoms of dengue, many people experience no signs or symptoms of a dengue infection. When symptoms occur, they are usually mistaken to other illnesses such as flu. Primary symptoms appear 3 to 15 days after the mosquito bite, and it includes high fever, severe headache with severe pain behind the eyes that is apparent when trying to move the eyes. Other associated symptoms are joint pain, muscle and bone pain, rash, and mild bleeding. Many people affected also complain of low back pain. The lymph nodes of the neck and groin may be swollen. Young children and other people infected for the first time typically have milder symptoms than older children and other adults.
Other signs and symptoms include severe abdominal pain, prolonged vomiting, and breathing problems. Bleeding tendencies including easy bruising, nosebleeds, bleeding gums, skin hemorrhages, and even internal bleeding may occur. The disease may progress to failure of the circulatory system, leading to shock and death.
Dengue laboratory and diagnosis. Dengue should be suspected in a patient with compatible signs and symptoms, as well as who typically lives or recently traveled to a disease-endemic area. They are typically present with acute onset of fever, headaches, body aches, and sometimes rash. So the methods of diagnosis includes nucleic acid amplification test or NAATs, serologic test, cross-reactive flavivirus test, and IgG antibody testing. So first, we have nucleic acid amplification test or NAATs. For patients with suspected dengue virus disease, NAATs are the preferred method of laboratory diagnosis. This technique should be performed on serum specimen collected 7 days or less after symptom onset. Laboratory confirmation can be made from a single acute phase serum specimen obtained early in the illness by detecting viral genomic sequences with RT-PCR or NS1 antigen by immunoassay. Presence of virus by RT-PCR NS1 antigen in a single diagnostic specimen is considered laboratory confirmation of dengue in patients. Next is the serologic test. This technique can detect the antibodies produced against the virus. However, this test may give false positive results due to their cross-reactivity between other flaviviruses like Zika and Japanese encephalitis. So for patients who present within the first week after symptom onset, both IgM and NS1 or NAATs should be done. On the other hand, for patients who present more than after a week of symptom onset, IgM should be performed. So next is the cross-reactive flaviviruses. If infection is likely to have occurred in a place where other potentially cross-reactive flaviviruses circulate, both molecular and serologic diagnostic testing for dengue and other flaviviruses should be performed. People infected with or vaccinated against the other flaviviruses may produce cross-reactive flaviviruses antibodies, resulting to a false positive serologic dengue diagnostic test results. Lastly, the IgG antibody testing. IgG detection by ELISA in a single serum sample is not useful for diagnostic testing because it remains detectable for life after dengue virus infection.
Nursing management. Nursing management of a patient with dengue fever is essential in achieving complete recovery. Nursing assessment. Assessment of a patient with dengue fever should include the following: evaluating of a patient's vital signs, assessment of evidence of bleeding in the skin and the other side, measurement and assessment of the urine output of the patient. Next will be the nursing diagnosis. Based on the assessment data collection, the major nursing diagnoses for a patient with dengue fever include the following: risk for bleeding related to the possible impaired liver function. Next is pain related to the abdominal pain and the severe headache. Next will be the rest for shock related to the function in the circulatory system.
And now let's go to the nursing care planning and goals for the patient with dengue hemorrhagic fever or DHF. So the goals in a patient with DHF are: the patient should be free of signs of bleeding, and the patient should display laboratory results are within the normal range, and the patient should report the pain is relieved and controlled. And lastly, the patient should be afebrile and free from other signs of infections. And now let's go to the intervention that are appropriate for dengue hemorrhagic fever. So we always have to monitor the patient's vital signs, so particularly the blood pressure. And then we have to monitor the pain of the patient, so that if the patient is in pain, we have to give the right intervention. Lastly, we have to monitor the medication regimen of the patient with DHF. So we can give the right drug, the right dose, at the right route, given at the right time to the right patient, so that we can do a right documentation. Lastly, if the goals have been met and the nursing care plan is successful, the result should be the patient has an absence of signs of bleeding, and the patient displayed laboratory results within the normal range, and the patient is now free of pain. And lastly, the patient is now afebrile and he or she is free from other signs of infections.
And these are the medical management of dengue. First is oral rehydration therapy. Oral rehydration therapy is recommended for patients with moderate dehydration caused by high fever and vomiting. Why is hydration important in dengue? Doctors say that there are a lot of diseases presented with fever and low platelet counts, such as chikungunya, yellow fever, HIV, hepatitis B and C, malaria, or leptospirosis. Even if somebody is diagnosed with dengue, they can easily manage the disease at home by keeping themselves hydrated. Next to the medical management is IV fluids. IV fluid administration is indicated for patients with dehydration. An ideal intravenous fluid for patients with dengue is one that is isotonic. Isotonic solutions are useful when the patient has lost fluid volume from blood loss, trauma, or dehydration due to excessive nausea or vomiting, or diarrhea, as these are the symptoms of dengue. Next is blood transfusion and blood products. Patients with internal or gastrointestinal bleeding may require transfusion, and patients with coagulopathy may require fresh frozen plasma.
So, in addition to what my partner discussed, the fourth medical management is oral fluids. Increase in oral fluids is also helpful because there are many advantages in encouraging oral fluid intake for suspected dengue patients. In terms of averting the risk of fluid overload with all its complications, cost savings in preventing intravenous fluid, and the possibly better quality of life. In fact, based on this study, the World Health Organization had revised their dengue guidelines in year 2009, and it includes the recommendation of oral fluid intake of 5 glasses or more for adults who were suspected to have a dengue fever. Examples of such are milk, fruit juice, oral rehydration solution, barley, rice water, or coconut water. The fifth and the last one is avoid aspirins, as aspirin can thin the blood. Aspirin is an antiplatelet drug that prevents clots from forming its MO. In addition, the aspirin lowers the blood pressure, and then the dengue increases capillary permeability, which in return reduces blood pressure. And then, prescribing a medication which lowers the blood pressure for a disease that also lowers blood pressure would not be a good decision. So in addition, intense cases of dengue lead to hemorrhagic fever with a lower level of blood platelets. Since aspirins prevents platelets from clumping together and then forming clots, prescribing it would surely aggravate any internal bleeding.
For additional information, during this rainy season, it is important not to neglect the dangers brought by dengue. So let's practice the 4S in dengue prevention and control. First S is to search and destroy the mosquito breeding grounds, such as stagnant water where most of the mosquitoes lies their egg and their most likely habitat. Then self-protection measures such as the use of long sleeves and mosquito repellents are very much encouraged. The third S is say no to indiscriminate fagging when there is no outbreak. It might cause health complications to some with breathing problems or with health problems. Then seek early consultation when fever, rashes, headaches, vomiting, and other symptoms arise. There is no specific treatment for dengue infection. If you think you may have dengue fever, refer to the signs and symptoms discussed by the recent clips, and you should use pain relievers with acetaminophen, also known as paracetamol. It is a medication used to treat fever and mild to moderate pain. Then you should take a rest, drink plenty of fluids, and see your doctor. So this concludes our health education video presentation, and I hope that what you've learned from this video will help and guide you to prevent from having dengue infection. Let's be aware. Let's help lessen the mortality rate of dengue infection in our nation and to the whole world. Because we, together, fight against the mosquito. Thank you. Stay safe and God bless.